The empty follicle syndrome in IVF. Hi, I'm going to talk to you about what an empty follicle syndrome is. And if you want to learn a little bit more about it, watch the entire video. I run an IVF clinic in Mumbai in the real world and online at www.drmalpani.com, and I've been doing IVF for over 30 years. We've treated thousands of patients with my wife, Dr. Anjali. And because we're specialists, we do only IVF and nothing else. And fortunately, most IVF cycles are fairly uneventful. They'll go exactly the way they're supposed to go, which means you'll have a good response. The doctor will go in with the egg collection when he can see lots of follicles, which are 18 to 20 millimeters. Your estrogen levels are fine. He sticks a needle. He'll get out the eggs, tell you, hey, we got 10 eggs or 12 eggs or whatever. The embryologist will fertilize them. You'll have embryos. They'll show you the blastocysts. They'll transfer them. And hopefully you have a baby. Now, if there's a happy ending, really, you don't even need to be watching this video, do you? Not all IVF cycles have happy endings. And one of the unhappy endings is called empty follicle syndrome. And let me explain this. Ideally, it's a fairly self-explanatory word. And ideally, every IVF patient should know exactly what this is, because every IVF patient should become an expert IVF patient, should become an expert on IVF cycles before they start an IVF cycle. Which is not to say they need to know how to do IVF or they need to know how to treat an empty follicle syndrome, but they need to know that this is one of those rare complications which can occur. As the name suggests, what happens is everything seems fine, lots of follicles, good estrogen levels in your blood. The doctor starts the egg pickup, and to their dismay, they find that every time they stick a needle in the egg and collect the follicular fluid, everything's going technically perfectly in the theater. But when they send that follicular fluid to the embryologist in the IVF lab, and the embryologist checks that follicular fluid under the microscope, under a stereo zoom microscope, he finds there's no egg in the follicular fluid. Now it's okay for perhaps not finding one egg in one follicle, not finding eggs in two follicles. But by the time they've done 3 and 4 follicles and not found any eggs, that's a problem. That's a red alert. The doctor should stop. This is called an empty follicle syndrome, which means the follicle, which is just a black bubble on an ultrasound screen, should have had an egg but didn't have an egg. But you can only find this out after the egg collection has started. Because it's only the embryologist who can tell you whether there was an egg in the follicle or not, because doctors can't see eggs on an ultrasound. And if you didn't know this, if you didn't know the difference between an egg and a follicle, you're in serious trouble, because that just means that you're not well informed at all, and you need to do your homework, get more information therapy before you start your IVF cycle. You can't leave everything up to the IVF doctor. And the right place to do your homework is on our website, which is www.drmalpani.com. But let's come back again. So now we're in the operation theater, the doctor's getting upset, the embryologist is getting upset, the doctor's not sure whether the embryologist is competent, is looking at the follicular fluids. And unfortunately, sometimes a lot of doctors are in such a hurry because they've got 4 patients and 5 patients, especially in these satellite IVF clinics where they batch patients together, and a doctor flies in and stays maybe just for 1 day and 2 days, and they batch all their patients, and they've got to finish 10 pickups in a period of 3 or 4 hours. The doctor can't even be bothered. They take pride. Hey, I finished the egg pickup. I finished the egg pickup in 5 minutes or 10 minutes, and see what a great doctor I am, without even realizing that the embryologist didn't find a single egg in any of these follicles. So anyway, you've started, you've not found anything. So a good doctor will stop and reassess the situation. The right time to reassess the situation is while the surgery is going on, not afterwards, because by that time the damage has been done, the harm has been done, the embryologist has no eggs, the doctor has flown off somewhere, and then obviously the patient has no eggs and no embryos and no baby, and all that money has got wasted. And the trouble is, then the doctor who did the egg pickup, the specialist IVF expert from Bombay who flew in, has flown out again, which means there's no one to answer the questions, and that IVF expert will then talk to the IVF clinic doctor, the local doctor, who obviously is completely clueless, but then has to bear the brunt of the patient's anger and doesn't know really, and will often hide the truth. So lots of problems. And I'll come back to that again in a second. But ideally what should happen is they should stop. They should confirm that technically everything's fine, the suction machine is working properly. If required, they should be able to change to a double puncture needle and start flushing the follicles to make sure that they're removing all the follicular fluid from each follicle, because sometimes the egg is hiding in the follicular wall and they may not get it. But if they're still not being able to get any eggs, then they need to do a blood test. And this blood test is called an HCG blood test. And obviously, if they can't manage an emergency HCG blood test, they should draw the blood sample and send it to the lab. But at that point, they should do a urine pregnancy test. Now, that might sound a little surprising. Why are you doing a urine pregnancy test at the time of a pickup? How could the patient be pregnant when you're just doing a pickup? And the reason for that is because the cause for the empty follicle syndrome, assuming it's not because of technical difficulty, is because the HCG injection, the ovulation trigger, the trigger shot, the HCG shot, the midnight shot, the Ovitrel, that was not given properly for whatever reason. Either the nurse didn't give the right injection or the patient didn't take it or whatever. But if for any reason that HCG shot is not given properly, then 36 hours later on, when the doctor does the egg pickup, because there's no HCG in the body, the follicle will not have matured, as a result of which the egg will remain trapped. It's no longer matured and will not be able to be extracted from the follicle. And that's why it's called an empty follicle syndrome. This is 99% of the time, this is iatrogenic because the HCG wasn't given properly. And obviously, when you figure that out by doing a pregnancy test and the pregnancy test is negative, that diagnosis is confirmed that this patient did not take the HCG properly. And then a good doctor should stop the procedure, leave the rest of the follicles as they are, not empty them because obviously they are empty, you're not going to get any eggs from them. Then needs to give another HCG shot and then repeat the egg pickup after 35 hours. This is extremely important because that cycle can be salvaged, it can be saved. There's no reason to waste that cycle. If this was a problem because the doctor, for whatever reason, ensured that it could be corrected, that if the patient hadn't taken the HCG shot properly, the doctor can correct it by giving the HCG shot and then doing the egg pickup properly. And any doctor who doesn't do this is actually doing a disservice and being very unfair to the poor patient. Now, when they don't do this properly, they start lying. All kinds of funny stories. Oh, your eggs were not accessible, you were too fat, the ovaries were too high, the needle was too short, we couldn't get in. When we got in, it started bleeding, or the embryo, all kinds of funny answers. And like I said before, when the IVF doctor who runs the local IVF clinic is not the one who's doing the egg pickup, they will often blame each other or they'll play ping pong, and it's the poor patient who gets squashed in the middle. So bottom line is the reason for empty follicle syndrome is iatrogenic because the HCG shot wasn't taken properly. This is something which can be prevented by making sure the HCG shot is taken properly. So for example, in our clinic, the patient administers the HCG shot, gives us a call the next day, confirms they took it, brings the empty HCG vial, injection syringe with them on the day of the pickup so the nurse can see that's been done properly. And in fact, some clinics will routinely do a urine pregnancy test on the day of egg collection before taking the patient in the theatre, because if they've taken the HCG properly 35 hours in advance, then obviously that HCG will be present in the urine. And this is one simple way of checking that the empty follicle syndrome doesn't occur. If you're unlucky and you do end up with empty follicle syndrome and hopefully your doctor tells you the truth, or even if he lies, you finally figure out that's what's happened. The good news is we can prevent that from happening in the next cycle. That's the good news. That the empty follicle syndrome wasn't because you're too old, or because your eggs are too old, or because your eggs are too bad, or there's something wrong with you, or your AMH level, all the kind of bullshit answers which doctors give when they're lying to you. It was a simple problem. The HCG wasn't given properly. It's a simple problem to fix. The next time you do the IVF cycle, do it in a better clinic and make sure that the HCG is given properly. And this time I can promise you, you will get lots of eggs. You want to find out more? Please go to our website. There's tons of information. You can process this at leisure, go through it multiple times, make sure you know exactly what's happening. And if you have more questions, feel free to email me. I answer emails free on our website, because if I can help you to have a baby by sharing the knowledge and wisdom and insights which I have as an IVF specialist, if I can help you with information therapy to become an expert IVF patient and get pregnant, nothing will give me more joy, because that's what I became an IVF specialist for, to help you to complete your family. See you.